Welcome to the EmpowerHer Entrepreneur podcast with Janis Boudreau, the ultimate destination for fearless women business owners ready to conquer their next level of success. Get ready to ignite your entrepreneurial spirit as we dive deep into all things related to building your empire, setting ambitious goals, and scaling your business to new heights. This podcast is your go-to resource for empowerment and encouragement. Tune in every week as we inspire, motivate, and empower you to embrace your full potential as a woman entrepreneur. Hi, everybody. This is Janis Boudreau, and we are here for another Empower Her Entrepreneur podcast. And we have a very, very special guest this week. We have a friend of mine, a colleague, and of course, the amazing Josee Hunter, who owns Happy Feet Medical Footcare and is doing some amazing things in the foot care industry. Not only does she teach, educate, offer courses that are webinars online, she even has her most recent blog that she's put out there to help all nurses nationwide get just a little bit better. Things are not always easy when we're starting out, especially in the foot care business. Some of us are new foot care nurses, and all the help that's out there is what you need. So I'm going to introduce you to Josee Hunter. And one of the reasons we brought her on is she's doing something really amazing in the industry right now. She is using her expert knowledge to help the CNA collaborate with the CAFCN to finally come out with something we really wanted, which was a certification process for foot care nurses nationwide in Canada. So here you go, Josee, on to you. If you could tell us more, maybe just a little bit about what's going on. I mean, all the ears are open. Everybody is like, I've even shot you tons of questions saying, what's going on? So give us more.
First, Janice, thank you for that awesome introduction. Thank you very much. I'm flattered. And of course, as good friends that we've been for the past few years, both of us growing up together in the foot care industry,
Yes.
I must say that you're also a huge powerhouse in this industry as well. So I'm part of the advisory committee for the CNA to get our specialty of foot care nurses certified. So what does this mean? I don't want people to be scared because it's not a policing certification. What it is a way for us to differentiate ourselves from those who are practicing best practice and continuing their education versus some of those nurses that have done it and kind of relax their practice and don't partake in the continuing education that they probably should in order to elevate our field. So with this certification, what it's going to do is it's going to make it so that we can move beyond our disrespected, I would say. So what makes certification of this specialty so important is that we really do need to move forward in our specialty and move past the limitations that have been set upon us by our fellow foot care professionals and the government itself. We need to be able to get those those grants, those contracts from the government. We need to be able to fight against those insurance companies for us to be covered under insurance policies. And we need to leave behind the nursing homes trying to underpay us and, you know, essentially just treat us as if we're charity to their underfunded healthcare system, right? So we need to move forward, and this is what the specialty will do. So also, I'd like to say this is also a voluntary option. So
Yes.
you can choose whether to do it or not to do it. There's no forcing, but I must say that I am personally going to, of course, go through with it. We've been working on this since before I even started foot care nursing myself. They've been working on trying to get this as a specialty.
Yes, I was on the board at the time and it was being discussed then. I think that was in, 2014.
Yeah.
And so it has been a process that we know needed to happen to make the changes. You've mentioned a couple things about how not all education's the same.
Yeah.
There's a lot of misconceptions over our own colleagues and foot nurses saying, you can do this, you can't do that. Oh, yes, you can. Oh, don't do that. There is just so many people, and they're not even us as foot nurses, we're not even practicing sometimes to our fullest capacity with advanced skills because we're unsure of where we're at and what we can do. I think
That's so true.
nationwide, this is where we need to go. Absolutely. Not only will I be getting it, I'll require all my nurses to have it. This is it's quite amazing. It's finally happening.
It's a big step for our specialty. It's a way for us to be able to garner the respect that we've
Yes.
needed and we deserve, frankly. It's a way for us to note that we're not a luxury option. We are actually an essential part of preventative health within the healthcare community. So this
Yes.
is going to help us validate ourselves. So did you want to know how they're going to go about?
Yes.
Yeah.
Yes.
So how they're going to go about um, certifying foot care nurses, I think is actually a phenomenal way because everybody has their own aptitude for communication
Yeah.
and ability to put portfolios together. So it's going to be a portfolio. It's not going to be a test written. What it's going to be is you could choose. They give you many different options of how you want to present your specialty and your abilities, and you could choose two out of the three, four to, just to show what you're able to do. So you could use pictures, you could use self-reflection, you could write an essay, you could do a verbal essay. So it's very inclusive
It is
for
very
everybody.
inclusive. I love to hear that because, like me and you, are kind of more video out there people.
That's
Not
right.
everyone. There's a lot of shy people who they're a little quieter. So sending a couple before and after photos, is that what you kind of mean? Like maybe being able to
Yeah,
show
yeah. So
I set up at my clinic, and I'm the best gold practice with reprocessing, which is huge too.
yes,
I'm sure
yeah,
this is a big part of that certification. Making
absolutely.
sure we're all following the same things. So this is very inclusive for everybody.
It's very inclusive for
Yeah.
everyone with any type of communication desires, right? So, and it also is going to incorporate our hours of work, which I think is
Ooh.
wonderful. Being a clinic owner
Mhm.
and being able to have new nurses for in the foot care special be able to graduate in and have that experience before they're actually certified. It's a way for us to be able to distinguish between seasoned foot care nurses, and
Yeah.
those who are just beginning. And it puts the pressure off those who are just beginning because they know that even though they're out of school or out of the classes, they still have time to get that education in and the hours of working in without feeling that they have to be just as good as the nurse beside them or the nurse next door in their town. Um, so it's a wonderful way of new nurses getting introduced into the specialty instead of just kind of throwing them into the deep end, which I feel a lot of us nurses when we first started felt that way.
Man, I could tell some stories back then. Oh, Lord.
Right.
Oh,
Yeah,
just even the
exactly.
nerve of it. I mean, I remember my first patient, which was my husband. He still complains about it. But it takes you an hour, right? And
Yeah.
by the time you're really good at your drill, your podiatry drill, and you're using all your tools, and I mean, I can probably get feet done nothing extra included. Under 15 minutes, I go from an hour to one, but that's through so much practice and time, like you're
Well, time and practice, and you get a routine going, and you
yes,
stop
your
having to think
groove.
about exactly. Your hands are just working, and your mind
Yeah.
is working at the same time, but they're doing two different things.
You can't
And
talk at the same time, ask
and
questions.
you're having a conversation, and your
Out.
conversation, although is so fluid and wonderful, you're still doing your
Yeah.
assessments as you're having that
Wild.
conversation, and you're
Doing it.
pulling things out of their lifestyle that
Yeah.
from what you're talking about that is actually affecting their health or
I
their
know.
feet. So yeah, so it is absolutely amazing how you grow with the profession.
So one of the things I'll bring up because I know it's the question is I mean I remember even sending you a nervous messenger is what happens to say us foot care nurses. I think it's the ones who've been around like us for
Mm,
a while. So if I've been around for 14 years, well, does this include me? Am I going to have to
mm.
go back to school? Am I going to have to take more education workshops, webinars? What am I going to have to do?
Yeah.
Probably not me, but maybe some out there that
No,
haven't took any additional training.
it is
They're a little
absolutely
worried. What am I going to do?
absolutely valid concern
Yeah.
for us nurses who've been working for quite a while and have a lot of education under our belt. First
Mhm.
off, that portfolio really will help us out, because it will we'll be able to show our skill, but also the training that we do for other nurses counts as our education ourselves, right? And I don't know about you, Janice, but for me, when I'm writing a workshop or
Yes.
a webinar,
Oh,
trying to get my hands on onto paper is
yeah.
actually really eye-opening for me because it really does outline what I'm doing without, because like I said, we've been working for so long, our hands just
Yes.
know what to do. And to try to put that
Yes.
into words is not
Yes.
always easy. So again, like I said, the CNA really does take that into account. And that could go towards your own hours of education as well.
And
Um,
that's
yeah, so
perfect.
it is
Me too. I
wonderful.
think
So
we're good.
right?
We're good.
Exactly. So yeah, so those
But
seasoned nurses who are doing the mentorships and everything too,
yes.
that's all going to count towards your education as well. That being said, of course, we always know there's more to learn out there. Even as ourselves educators and nurses that have been doing this for 30 plus years, there's always new techniques, new courses,
Always.
conferences itself goes towards those hours as well.
Absolutely.
And so it is really exciting actually because it makes you excited for our industry, excited to
Yes.
learn new things. You don't get stagnant in this little box of your own little area because we're all independent in our nursing, right? Before we started this specialty, we were used to a collaborative environment, whether it be a nursing home, a hospital. We worked with
Yes.
so many people, and then we went into this specialty, and all of a sudden it was just you and the client, and it was very different, and we all had to adjust. Um, so getting back into making sure that we are all working together again is actually really exciting because together I think we can make something beautiful and amazing within this specialty, and we can
Yes.
move it even more forward and forward. I mean, just look at how far we've come in the
Mhm.
past 10 years for foot
Oh,
care. It's
complete
insane,
turnaround.
the amount that we've been able to accomplish as nurses for our clients just through
Knowledge.
advocacy,
Yeah.
right? And knowledge. I mean, we saw what
So
our clients needed and we made sure we were able to provide it. So
products,
it's
tools, all of
exactly,
those things.
oh, all of those
Look at
things.
the things we and you were using a decade ago. I just look, I'm like, how the heck? Sometimes I even wonder how I did foot care.
Right,
Like what's
right.
offered now to make things a lot easier. So
Well, exactly,
I'm hoping
exactly.
through this registration that maybe people who haven't got any education, I
Mhm.
mean, there could be somebody who took it 15 years ago and
Yeah,
really hasn't, easy words, up their game.
yeah,
Like that
that's
simple
right.
course they're not offering. So I'm hoping also that that may cause everybody to go up the ladder a little bit.
Well,
And
and that's
they
and
have to
find
say,
their
you know,
passion again,
yeah,
find
find
their
their passion,
passion
get back to
because
school,
you could get
mentor
stagnant, you could
someone.
get
Mhm,
upset, you could get frustrated, and you
mhm.
get lost in the everyday. But then whenever, I don't know about you guys, but whenever I go to a conference, everything, you just find that passion. You get so excited about your job, about
So
your
fun.
specialty. And it just brings everything back in to wanting to learn more and do more and talk more and be more. So, it is. I find that this certification is going to just help us always move forward and get excited about our specialty.
Do
Yeah.
you, is there any registration process or any time set when this may open?
Yeah. So you need
Tickets,
to be
anything
a
like
practicing foot
that?
care nurse.
Hmm.
I think they have it's equivalent of 2 years of practicing before
Okay.
you can actually apply to be
Hmm.
certified. We'll have to verify that because, of course, we're still fine tuning all the
Right.
requirements.
You're working on it. I know this is
Yeah,
a huge
yeah. So,
project
but
everyone wants
we're
to,
getting
yes.
pretty close to nailing these things down. Um, and then it's only once every 5 years that you need to recertify. So you have 5 years to build your portfolio, to include extra things, to find exciting things to talk about. Research is also included in all that as well. So yeah, you have the 5 years, and then you just have to renew your certification at once every 5 years. So
Yes.
it's actually very, very reasonable to be able to get your certification. Yes, you have to put together a portfolio, but honestly, in order for us to be able to say we're certified foot care nurses, look at what I'm able to do. We're doing that every day anyway. I have I call it my brag book that I have out so that people can see what I'm able to do, because there's no other way for me to say I'm great, right? Or this is how much experience I have compared to somebody I feel that might not have as much experience, right?
Right.
This is why I charge this much
Yes.
versus this lower price point, because I know what to do when I see A, B, and C, right? Or D,
Yes.
E, and F all the way to Z. So this is why these certifications are great, because I no longer need to have to justify, I guess, my price points, or feel like I have to brag myself up in order
Right.
to have people know how great I am, right? So we
Because you're
are great.
certified.
And
You
this
have your,
certified right
yes.
after my name is going to say I am great. I mean, we respect it. The CNA has certified pediatric specialty,
Yes.
surgical specialty, the critical care specialty of nurses, and all these specialties
Mhm.
are recognized and respected
They sure
within the
are.
healthcare system, right? So
Absolutely.
when we need wound care, we go and get a certified
Right.
wound care
Very special.
nurse,
Yeah.
right? So how come when they need something done with the feet, lower legs, they don't outreach and look for us foot care nurses? How many nurses out there don't even know that we exist as a specialty, which is baffling to me, but so true.
Everywhere. Because people say, what do you do? What do you own? Like I do when
Exactly.
I'm gone for the weekend, I start to tell them, and the blank look in their face.
Yes.
They're like,
Yeah.
oh, so that's like, you're like a podiatrist. I'm like, no, I'm not
No.
a podiatrist. I'm not so trying to explain to them,
Exactly.
I will have more comfort in saying, there's something about saying, well, I'm a nurse, but I took extra training.
That's right.
Just saying, I am a certified, like it's just a whole level.
It's a whole extra level.
Sounds better, it
Exactly.
feels better. Because
Yeah.
it's still puzzling when I'm explaining to them. And like you say, we've had to have this long list of all this great stuff we've done, and the
That's right.
tools, how trying to prove ourselves, where
That's right.
this is the proof, you know.
The proof is exactly. And also, when you think of it as well, I don't know how other people have felt, but I'm going to give an example of when COVID hit, and we all had to kind of stop for a second and rewrite all of our policies and procedures, right? To make sure that it was now inclusive of COVID and infection control.
Yes,
We have to upgrade everything.
total game changer.
We are monitored by the Ministry of Health.
Hmm.
And when I reopened my clinic, I contacted my worker at the Ministry of Health, and he had actually said out loud on the phone, why is toenail polish so important in critical care for during COVID? And
Hmm.
I felt like putting my hand through and smacking him across the face, because I'm like, you're supposed to be in charge of monitoring me, and I have to explain to you what I do in my clinic. And
Yes.
it was like eyes wide open at that point, because even the people who are supposed to monitor us in our field don't realize our capabilities and our abilities to help with preventative care, reactive care, just comfort
Totally
care
agree.
as a whole, right? We
Yes.
truly are a holistic specialty, because there's so much that you could find out from a person's foot, regardless of what's going on with the rest of their body. You see it happening down at those lower extremities, because they are the last place that our blood flow can get to. And they show all the effects that is happening within our body.
Mhm.
We can see from one, and we're who else sees their patient every 4 to 6 weeks to be able to
I
see the
we know
difference,
everything
right?
going on. We know everything.
Exactly.
Right.
During COVID, when I reopened my clinic, I became the triage nurse for the doctors in my community, because I was the one saying, okay, the edema is getting too bad. And I
Yes.
would write a referral to the doctor to let them know that they need to up the medications, or, choose another course of action.
Mm.
I was the one that was monitoring the wound care. I was the, so yes. So again, just to say, we are damn important specialty, and we deserve to be
And we've
acknowledged
been
for what we
waiting
are able
for
to
it.
do.
We
Yeah,
have been waiting for it absolutely forever. I think
yeah,
it's going to make a profound difference in being
yeah,
able to explain ourselves. I really
absolutely.
hope that my only suggestion, and I love that you're on the advisory committee, is I'd love to see the CNA work with the CAFCN and maybe get some marketing out there. People need marketing about who
Mhm.
we are and what we do. Because we know we've got ostomy, we've got like surgical, like you're saying, we've got all the
Yes.
specialties. I know them and you know them like
Yeah,
forever now. But maybe some education out there and some marketing about the collaboration.
that's right.
And hey, in Ontario or whatever province, make sure to see your certified foot care nurse professional out there.
Exactly. And you know what, though, by freeing up the CAFCN, the CFCN, from this uh, certification, they've been pushing for this for so long. Like you said, Janice, they were
Oh,
pushing for
yeah.
it when you were on the committee. We
Yep.
finally reached it. So now that we have this, they can move forward into a new thought, right? They can move to a new ideas, and promotion is probably going to be one of the top ones up there,
Love it. I love it.
because now that we're certified, right now it's time to let everybody know that we're
Yes.
certified and that we're out there, and it's time for that education. We're always worried about where our money is going when we sign up with these
Mm.
associations. We don't always see the benefit because it's not
Yes.
day to day benefit. But
Hmm.
what we've been investing in for years and years is just
Right.
this,
Company.
exactly this, right? This is
Yeah.
what they've been working behind the scenes to get us. And they've been doing an amazing, thankless job for years and years. And these ladies and gentlemen that have been working behind the scenes have been giving us all this great platform to be able to jump off of and to be able to move forward with. So,
Yeah. And
yeah.
anybody out there, if we use the term CAFCN, it's Canadian Associations of Foot Care Nurses. If
Hmm.
anybody is not a member, I would suggest you join. These are the people who
Absolutely.
are bringing us our biggest joy, which is going to be certification and finally recognition on our field. Being a part of this association has many benefits. The resources, information. They're now doing a monthly meeting. Every area, right, Josie? I'm pretty
That's
sure they
right.
still have it. They have Ontario, they have a chair. There's people for you to bounce ideas off of,
That's right.
to talk to, get information. The conference is always a blast, and
Always amazing. Yeah.
great to pay
They
your
truly are a way to make an independent nurse have a community. They're
yeah,
a way for us to become a community again, for
yes,
us to be able to work together. And like nurses, we're more powerful when we're all together. And
yes, exactly.
soundboarding is so important within our specialty, within nursing, period. We can't just assume that everything we do is right, everything we know is correct. We need to be able to bounce ideas off of things, and that's how we learn, and that's how we progress, right? So,
And it's affordable, everybody. Come on.
oh
This
my
is
God,
the
it's
most
so
affordable
affordable.
association I'm possibly in out of
I know.
anything. I'm
And it
like,
gives us the
really?
most benefit, right? So,
It is, and it's
absolutely.
a fun group of women.
It really
I
is.
think
Yeah,
that's even how I met you all those years ago was
probably. Yeah.
association. It was at some type of conference. Is there anything else as we shut down for a bit out of the podcast? Any other notes? Or I think you've covered it all. You've covered what the certification, you've talked about the portfolio. I definitely am having you back as soon as this opens to do a podcast just on portfolio health.
Absolutely.
I think that would be
Yes.
a great podcast that you can speak to everybody and maybe give them some ideas and make them feel a bit more
Absolutely.
comfortable. Is there anything else on your list that you can think that we need to know?
Yeah, well, I just kind of want to summarize because a lot of people keep
Yes.
thinking, oh my God, another one, another reason for me to have to spend
Yeah.
my money,
Yeah.
right? And again, like I said, a lot of times it's hard to see the benefit when it's not immediate. Well, this one actually will be immediate, right? Because
Yes.
it's a way to differentiate the different levels of care that we're able to provide, right? So we could now differentiate ourselves from those who aren't practicing the best practice or
Mhm.
up to speed in their education, right? It'll garner more respect, not
Mhm.
within just our community, but in the healthcare community as well. And we know that when we work with our peers, yeah, business will come to us, but also the specialties will start recognizing us and respect us, right? And again, more respect often equals more pay. So we know that foot care
Yeah.
nurses have been the most underpaid specialty, and it's probably because we
Yes.
haven't been certified. We're not officially recognized yet. So with that authentication of our specialty, I suspect we'll get more increase in pay. And we say that it's the clients
Yes.
that pay us. Absolutely. But if we have the backing of the community, if more doctors say you need to go see a foot care nurse, and
Yes.
again, a lot of our clientele are in the age where they're in retirement homes and nursing homes. And those retirement and nursing homes are always the one trying to undercut us. So where
Yeah.
does that fall when the clients are trying to also get their care and see the price points? They'll go with their trusted home of what they believe they should be paying. And so if we could get those homes on board with us and seeing the benefit, because again, with those benefits, it's not just foot care we're providing comfort, which means that their aggressive behaviors will be down, their comfort levels will be up. We're giving them one-on-one attention for nursing. So we could sometimes find these things that might get missed by nurses that have been overworked for years, not just days, but years, for these
Any,
nurses to give them a break so that we could actually walk in and we could help them out and say, this is what I'm seeing. This is the edema that I'm seeing.
yes.
Probably needs a specialty for this. So it's gonna be great to have the certification to be recognized. And my big thing, and is because it personally affected me in my community, is government grants. So grants have often been given to the bigger
Like corporate or, and
yeah, the care
higher
program.
living.
So the bigger
Yeah.
companies, like in Ontario, there's Care for,
Mhm.
there's Bayshore Home Health Care, and when I lost a few of my clients to grants from the government, and I called specifically and asked, well, these are my clients, so the
Yes.
best care they're going to get is from the care that they're getting from their nurse that has already been
Yes.
working with them for years. Why can't you give me this grant and then I'll be able to provide the care? And their statement was, because we can't give grants to all these little companies. We just we're going to give it to the bigger company because they're all throughout Ontario. But
Mhm.
the problem is these bigger companies all throughout Ontario, foot care is so at the bottom of their list that they rarely have nurses to provide the care. So, the government grant goes to naught because then nobody has the care to provide it. So
Yeah.
I find that with this certification,
I agree.
again, we
This
could
is a problem
we
too.
could leverage this. We could leverage this to get us into a position where we could help more people, and
And
have
both
the
of our
government help
companies,
us help people,
yes,
right?
and both of our companies, I can speak for mine and yours, are 100% foot care, lower limb care.
That's
As
right.
opposed to, and that's great, other bigger companies, wonderful. They offer a million different specialties with home care and this and that. But there's something to be said when it is just, we're just dynamic at what we do in foot
That's right.
care. We should be getting those grants. I can assure you, my company has never received one
That's right.
because they'll go to these large companies, exactly like you're saying, who half the time it's a turnover of the foot care nurses,
That's
or they
right.
don't even have one year.
That's right.
And then we're covering them for that year, which is fun. And then finally they hire one again. It is. I hope all of
Yeah,
this changes because we truly are the specialists in our field.
absolutely. Yeah, and I believe by certifying this will help us
Mhm.
stabilize our specialty
Yeah.
and make it more recognized throughout Canada,
Mhm.
and within the healthcare community itself. So,
I'm looking forward to it.
mhm.
So everybody who's been on the call, we got our inside information about what's been going on with the meetings with the advisory committee. And Josee, as always, you are loved by many all over Canada. You're a fun foot nurse, you're friendly, but you offer goal practice care, which
Thank
is
you.
extremely important. So it's nice to see that you're on that committee. And we're hoping we'll have Josee back as a guest, maybe towards the end of the year, beginning of the new year, and she can give us even more information how we are progressing. This is like the best progression I've seen in a decade. So everybody out there, make sure to follow Josee, see what she's doing, check out her new blog, and also if you have time, check out CAFCN and grab your membership and become a part of something much bigger that's happening. And cheers to everybody. Thanks, Josee.
Thank you.